Okay, guys, this is Dee for you all, discussing seniors in nursing homes often face emotional challenges tied to major life transitions and changes. Here are some common ones. Okay, first one, loneliness and isolation. Being away from familiar surroundings, friends, or family can lead to feelings of um, disconnection and solitude. Okay, second one, loss of independence. Depending on others for basic needs can affect self esteem and create frustration. Third one, grief and loss. The absence of loved ones or the experience of losing friends and peers might weigh heavy on their emotional well being. Then you got four, which is anxiety or depression. Adjusting to a new living environment and lifestyle can be overwhelming, triggering mental health challenges. Okay, then you get fear of abandonment. Some might worry about being neglected or forgotten by family or and friends. Um, then you've got interpersonal conflicts, sharing a living space with others, and adjusting to community rules can occasionally create tension. Then, folks, you get into um, when you have a group of seniors who have to share spaces between each other. Sometimes you get into people uh, creating havoc. What I mean by that is um, some people aren't used to being in community spaces. Some people have hard times giving up their own personal belongings, like because what I mean by that is nursing home only has half a room with, people have to share um, rooms, like semi-private rooms. So in that case, you only have so much space to bring things for, to bring your own personal things. So my suggestion for that, when that arises, what you do is you go see the go look at the space with your family member, and when you guys come back to the house, figure out what they really means what to them, and what they want to bring to the facility. Like sometimes people bring a favorite chair, favorite blankets, favorite dressers, their own TVs, things, but you have to scale it down so it fits in their space. Because remember what I said, they share a room with another person. So you have to split the room in half. One person gets one half, the other person gets the other. Sometimes, you know, hopefully, when you put a person in a room with somebody, hopefully they get along, because sometimes people don't get along. Sometimes you have to reevaluate where somebody is. to make them more comfortable. You have to, change rooms. It's like playing musical rooms for people. That happens. When I used to volunteer, I used to see in facilities, I used to see people have to shift people around a lot for different reasons. For, maybe they don't get along with their roommates, so they have to have a change. Or maybe somebody's causing somebody um, major distress or frustration. So then we have to sit down and figure out, what works best for this person. Um, you have to take the time to help them adjust. Also, they have to be able to sit down and talk to somebody. So me as a volunteer, what I used to do is I used to go in, introduce myself, help them get adjusted, but you have to earn their trust. You have to earn the residents' trust that's just moved in or just moving in. You have to introduce yourself. You have to put yourself out there so that they can trust you as a volunteer to help them navigate the space. That's what my job used to be. Um, it wasn't always easy. I always had to figure things out. You know, people have different ways of having things done. So you always have to figure out what works for that person. So, okay, we're down to um, grief and loss. Okay, the absence of loved ones on the on or the experience of losing friends and peers may weigh heavy on their emotional well-being. Now, when I used to volunteer, we had um, we had people pass away in the facility. So, like if their roommate was really close to them, me as a volunteer, I'd go in and I'd have a I'd have sit down and have a chat with their roommate to help them, with their feelings of losing their roommate. Because if they get to know each other, they spend the rest of their life in the same room together. That weighs heavy on a person also. So, you have to take into consideration that kind of stuff for them. Let's see. The next one, anxiety and depression. Now, if someone's family doesn't come see them for long periods of time, they get depressed. Some of them have anxiety about seeing certain family members, so you have to treat that carefully also. Okay. Fear of abandonment. Some people, when I used to volunteer, we had family members who would drop their family member off and not come see them. Okay, that weighs heavy on a person, on a resident also. So, you, me as a volunteer, I would have to spend a lot of time with someone. Like I said earlier, you have to get their trust. You have to see them every day, so that doesn't that the abandonment doesn't happen. The feelings of being alone, having their family member leave them and not come back. That does weigh heavy on a person. So me as a volunteer, I used to have to spend like months and just going back and forth and seeing them every day. But I was their outside voice for some people. And when you have someone like that, little things mean a lot for them. Meaning that, if this person wanted to go have a cheeseburger, but they didn't want to go alone. Sometimes I would go sit with them at the snack bar and let them have their hamburger while I sat there. Coke, hamburger, that mattered. Me as a volunteer, I didn't care about having to sit with them. What I cared about was them as a person. And I cared about the way they were taken care of, because person didn't have any family member to come see them. So what I had to do was I had to check on them every day to see, that they were taken care of the right, correct way for care. And then when I became a nursing home transition person, that carried over. Some of my skills carried over to that also. Meaning I got to deal with that in a deeper sense when helping them out of a nursing home to their own apartment. You have to make sure that their priorities are set up right, that their services run right. You can't just have a resident go do an apartment without a attendant care setup, or you have to teach them the right way of functioning. So that was part of my job also. So let's go down to the next section, shall we? Okay, we're at interpersonal conflicts, sharing living spaces with others, and adjusting to community rules can occasionally create tension. Like I said, when they're not used to being in a facility, having to share things with other folks, they get very agitated, because they want to understand why. First of all, they want to understand why their family member put them in a nursing home. That's the first one you have to deal with. Then the second thing is you have to explain to them the community spaces in a nursing home that they have to share with their roommates, or fellow residents. Like, for instance, you have to explain to them that half the room is their roommate and half is theirs. And then you have to take them on a little tour and show them the community spaces that everybody shares, like a big dining room, big activity room, big day room with the TVs and everything. So they have an idea that they have to share spaces. They have to get used to sharing spaces. You have to teach some people that are not used to being in nursing homes. Now, some people, that's all they know. Nursing home life is all they know. So when you get them out of a nursing home, and you get them into an apartment, you have to sit down with them and explain to them that they don't have the call bell anymore. That they're going to have, staff come in and help them. Sometimes you have to set up like two or three shifts for a client or for a resident to function in a apartment setting. But it can be done if it's set right. But being in a nursing home for a person that's not used to being there is very traumatic. Let's see where we're at. Okay, last one, guys. Last section, creating a supportive and stimulating environment with, let's see, with meaningful activities and regular family visits can make a significant positive impact. Okay. The question here, guys, is would you like ideas for such activities or advice on addressing these challenges? Okay, so that's D. Be back on shortly with E. Give me a few minutes for E, please. I'll have it on for you shortly. For now, Gator Wellness, take care, folks.